I shall talk to you today about hernia. Hernia is, in medical terms, is a protrusion of intra-abdominal content into the abdominal wall. The three common hernias which one notices is one is the umbilical hernia, that is a protrusion in the area of the umbilicus. The other one is the inguinal hernia, that is the hernias at the lower end side of the abdomen where the thigh meets the abdomen. And the third and the common one is the ventral hernia, or otherwise called the incisional hernia, which will occur after an operation where the area becomes weak. Now, I shall talk to you about the umbilical and the inguinal hernia in this episode. Umbilicus is a naturally weak area in the abdomen because that is where the umbilical cord links the mother and the child, and when the umbilicus heals in a couple of people, it does not heal very well. So, the area looks very thin, and you often see children with protruding belly button. Until 2 years time, this umbilical hernia does not require any treatment, but after 2 years if it does not become small, that will require some sort of surgical treatment. Umbilical hernia is also seen in adults and especially in women after childbirth, and even in men folk who have very big protuberant abdomens, which is a very common feature in India. And here usually either the fat from inside the abdomen or the intestines can sort of protrude into the umbilicus. And over a period of time, these umbilical hernias can become big and become symptomatic. Whenever anybody has pain in this hernia, it will require treatment, or even if it is big, or when somebody can notice a gurgling sound when the hernia disappears, this has to be looked into. Likewise, inguinal hernia, hernias at the lower end of the abdomen, is a very common condition and is seen in both young and the old. And this is also due to a weakness in the area of the abdomen, which is responsible for this hernia. In any patient presenting with the swelling which increases on standing up or straining or while passing motion or lifting weights, that needs attention and should see a doctor, a surgeon preferably. And the surgeon will just check on to find out whether there is any difficulty in passing urine, because especially in the elderly, when they strain to pass urine, the hernias become prominent, and in others who have constipation, we have to constantly strain to pass motion, is another condition can lead to hernias. And also in people, young people lifting heavy weights like weightlifters, and also people have chronic cough because it's like COPD or bronchial asthma. When they keep on coughing, the pressure inside the abdomen increases and that can cause hernia. And once all these are checked up and made sure they are not present, then in the elderly patients especially who have diabetes, blood pressure, asthma, etc., they have to be checked by the anesthetists and the concerned specialists to make sure they are fit for surgery. All hernias have to undergo some form of treatment. A few hernias, especially in the elderly, which are asymptomatic, can be left alone, but otherwise hernias require surgical treatment. Umbilical hernia, for instance, which I was talking about earlier, this hernia is small. We need to just make a cut under the umbilicus outside and close it in a very simple manner, but the hernia is somewhat big. The surgeon decides it more than 2.5 centimeter size, that requires a mesh repair. In other words, we need to put a net on the area to suture, and this is done mostly by laparoscopy. We do it by laparoscopy as a daycare surgery. We make small holes in the abdomen, go into the abdomen, have a look at the umbilical orifice from inside and clear the intestine or the fat that is inside it, pull it down, take a mesh which is a double sided mesh, the smooth side towards the intestines and the rough side towards the abdominal wall, and we stick it to the abdominal wall by small screws and some stitches. This is called laparoscopic umbilical hernia mesh repair, and this will not take more than about 20 to 30 minutes, and the patient will be back to her routine work in about 24 hours. And when the inguinal hernia also has a similar procedure where through 3 small holes in the abdomen the size of little finger, will go into the abdomen, have a look at the inguinal hernia, the defect from inside, and the defect is there is a thin membrane called a peritoneum covering it. We will just cut it open and peel it down. And there are 3-4 different hernias that can happen in that area. A wire net called a mesh is inserted again, and the membrane is stitched back to keep the mesh in position. This operation also does not take more than an hour, and patients will not have any pain after surgery. A few hernias which are very big and will go into the scrotum will require an open surgical repair, and also when a hernia is obstructed, in other words, sometimes patients come with severe abdominal pain because the hernia is not going back into the abdomen where intestine gets blocked, which will require an open operation. Why do hernias require surgery? Hernias require surgery because 1, they can become big, and 2, they can become obstructed, which makes it an emergency where we need to operate in the middle of the night. If you do not do that, the intestine which is protruded into it becomes gangrene, otherwise it becomes bloodless and can get damaged, you require a major operation. The problem with hernias, of course, that require a certain expertise to do a good laparoscopic hernia repair, and hernia recurrence after surgery is not uncommon. Certain hernias, especially when we do not take care of the constipation and difficulty in passing urine or chronic cough, the hernias can recur. And many people keep asking that, why do you use a wire mesh which is a foreign body? Why can't you do without? All hernias will require a mesh. Mesh is a foreign body, but then again, in a very handful of patients, this mesh can cause problems in terms of infection, requiring it to be removed, but majority of the patients will not require a mesh to be removed. The foreign body will be accepted with the body, and it will get assimilated into the system and does not cause any trouble. Hernia recurrence is a problem, and if it recurs, well, again that will require surgical treatment. So, in effect, umbilical hernias and inguinal hernias are not uncommon. They usually are caused because of weak abdominal wall and sometimes increased abdominal pressure due to straining. They have to be treated surgically, and a mesh has to be used, and preferably laparoscopically, and this is again a daycare surgery. Patients get back to their normalcy in about 2 days time. We generally ask them to avoid lifting weights for about a month or so, but then they will be normal. Thank you.